this morning to present to you a topic, the mechanism of action, uses, and the side effect of antipsychotic drug. Introduction. Antipsychotic drug, also known as a neuroleptic or major transclucent, are a class of a medication primarily used to manage symptoms of psychotic disorders such as schizophrenia, bipolar disorder, and severe depression with psychotic feature. These drugs work by altering the activities of neurotransmitter in the brain, particularly dopamine and serotonin, to reduce symptoms like hallucination, delusion, and disorganized thinking. Antipsychotic are categorized into two major groups. We have atypical, that's first generation, and typical, that's first generation, and atypical, second generation. Antipsychotic, which primarily atypical, which primarily target the dopamine receptor, and atypical second generation antipsychotic, which affect both dopamine and serotonin receptor, often with fever extrapyramidal side effects. Classification of antipsychotic drug. Antipsychotic are broadly classified into two categories, as I said, typical, that's first generation, and atypical second generation antipsychotic, based on their receptor binding profile and side effect. Number one, typical antipsychotic. Typical antipsychotic primarily block dopamine D2 receptor in the brain. They are further divided into they are further divided based on their chemical structure and potency. For example, now we like some antibiotics. We have some different class of antibiotics like penicillin. Under that penicillin, we have some different drug under them. That's exactly what I mean by the divided based on their chemical structure. Number one, we have phenothiazine. Under this phenothiazine, we have chlorpromethazine, we have tioridazine, and number two, we have butyphenol. Under this, we have haloperidol and domperidone. Number three, we have tiosamine. Under this one, we have flupentazole, and we have tiosin. Atypical, number two, atypical antipsychotic. Atypical antipsychotic target both dopamine D2 and the serotonin receptor, offering the efficacy for both positive and negative symptoms, that social withdrawal and apathy of schizophrenia. Example of atypical antipsychotic drug. We have clozapine, risperidone, olanzapine, and quetiapine. Mechanism of action of antipsychotic drug. Number one, typical antipsychotic, that's first generation. Typical antipsychotic such as haloperidol and chlorpromazine primarily act as a dopamine D2 receptor blockers. By blocking the D2 receptors in the mesolimbic pathway, they reduce excessive dopamine activating associated with positive symptoms of psychosis like hallucination and delusion. However, they are non-selective blockade of dopamine receptor in other pathways. Example, we have haloperidol has a high affinity for D2 receptor, that's dopamine receptor, effectively reducing dopamine hyperactivities in the mesophilic system, that's in the brain. Number two, atypical antipsychotic second generation mechanism of action. Atypical antipsychotic such as risperidone, olanzapine, and dosapine have a broader receptor profile acting on both dopamine and the serotonin receptor, often with lower D2 receptor occupancy. The 5-HT2A antagonists enhance dopamine release in the prefrontal cortex, improving negative symptoms. They also affect both receptor histamine, muscarinic alpha adrenergic, contributing to side effects like sedation or weight gain. Clozapine is also one of the second generation of antipsychotic drug. Clozapine unique for the effective efficacy in treatment-resistant schizophrenia. Clozapine has a lower D2 affinity and acts on the multiple receptors, including serotonin, D4, and the muscarinic receptor, reducing both positive and negative symptoms with minimal EPS. Other mechanism of action. Some antipsychotics modulate glutamate and GABA system indirectly, particularly in the treatment-resistant case. For example, clozapine may enhance NMDA receptor activities, improving cognitive symptoms. Additionally, antipsychotics can influence neuroplasticity and the gene expression over time, contributing to long-term therapy effects. Uses of antipsychotic drug. Number one, we have it serve as a psychiatric use. Psychiatric psychiatric use. Under this one, we have nausea and vomiting management. We have delirium in the critical care. We have pain and neuropathic pain. We have chronic pain and neuropathic pain, while insomnia and the sleep disorder. Side effect of antipsychotic drug. Typical antipsychotic drug. Number one, extrapyramidal symptoms. That's EPS. This include acute dystonia, that's muscle spasm, Parkinson and tardive dyskinesia. Number two, anticholinergic effect. Low potency typical antipsychotic example clozapine block muscarinic receptors, leading to dry mouth, constipation, blood vision, and urinary retention. Number three is sedation. Sedation is common, especially with low potency agent due to histamine 1 receptors blockade. This can impair daily function. We also have cardiovascular effects. Orthostatic hypotension and tachycardia result from alpha-1 adrenergic receptors blockade. Prolonged QT interval increasing the risk of arrhythmias is also concerned with some agents. Atypical antipsychotic. Number one, or side effect of that, we have metabolic and weight release effects, we have extrapyramidal symptoms, we have sedation and somnolence, we have endocrine and hormone effect, we have we also have what we call cardiovascular effects, gastrointestinal effect, we have hematological effect, we have neuroleptic malignant syndrome. Common to both of them. You mean that the common side effect that common with both of them. We have extra pyramidal syndrome, sedation, and somnolence. weight gain, and cardiovascular effects. Management of side effects, common side effects and management strategy. Number one, extrapyramidal syndrome. EDS include Parkinson, dystonia, akathisia, and tardive dyskinesia, primarily associated with fourth generation antipsychotic, but also observed with some second generation antipsychotic. These symptoms arise due to dopamine receptor blockade in the negostrial pathway. Management: dose reduction or switch, pharmacology intervention, tardive dyskinesia. Number two, metabolic side effects. SGAs such as olanzapine and clozapine are associated with weight gain, diabetes, and dyslipidemia due to effects on histamine, serotonin, and muscarinic receptor. In conclusion, antipsychotic drugs are a cornerstone in the management of psychotic disorder such as a schizophrenia and a bipolar disorder, significantly alleviating symptoms like hallucination, delusion, and disorganized thinking. This medication categorized into first and second generation, that's typical and atypical antipsychotic, work primarily by modulating dopamine and serotonin pathway in the brain. Thank you, sir.